If your hands or feet feel like they're being stabbed with thousands of tiny needles, if your fingers feel numb when you wake up, if your feet burn, tingle, or feel strangely dead when you walk, I need you to pause whatever you're doing right now and listen very carefully. Because what I'm about to share has already helped many people over the age of 60 regain feeling, balance, and confidence, sometimes in as little as 2 weeks using something simple, affordable, and often already sitting in a medicine cabinet. Just a few months ago, a 67-year-old patient sat across from me, fighting back tears. She told me she felt like her hands no longer belonged to her. She couldn't feel textures. She dropped cups. She avoided holding her grandchildren because she was afraid she wouldn't sense their grip. 14 days later, she called my office with a completely different voice. Calm, hopeful, relieved, she said. Doctor, my fingers feel alive again. I'm Dr. Emily Carter. For over 20 years, I've worked with adults over 60 who are struggling with nerve damage, numbness, burning pain, weakness, balance problems, and loss of coordination. And what breaks my heart the most is this. The vast majority of people suffering from these symptoms have never been told that a simple, correctable vitamin deficiency may be at the root of their problem. They're told it's just aging. They're told to live with it. Or worse, they're given medications that dull the symptoms while the nerve damage continues silently in the background. Today, I'm going to show you the exact B vitamin your nerves desperately need, why it works at the cellular level, how much to take, the critical mistake most seniors make that prevents real healing, and how to give your nerves the best chance to repair themselves naturally. Stay with me, because what you learn in the next few minutes could determine whether your hands and feet continue to worsen or finally begin to recover. Before we go any further, I'd love to know, where are you watching from today? And how old are you? Drop your age and location in the comments. It truly helps me tailor future content to people like you. Now, let me ask you something important. Do your hands or feet tingle when you lie down at night? Do you struggle to feel hot or cold water in the shower? Have buttons, zippers, or coins become harder to manage? Do you feel unsteady walking, especially on uneven ground? Or do you feel a burning sensation that seems to come from deep inside your feet? If you answered yes to even one of these questions, your nerves are sending out a distress signal. And here's what most people don't realize. This isn't just about discomfort. Untreated nerve damage increases your risk of falls. It steals independence. It erodes confidence. And over time, it can lead to permanent loss of sensation. So, let's talk about what's actually happening inside your body. Your nerves are like an incredibly complex electrical system. They carry messages from your brain to your muscles, your skin, your joints everywhere. But these nerves are not bare wires. They are wrapped in a protective coating called the myelin sheath. Think of it like the insulation around an electrical cord. As long as that insulation is healthy, nerve signals travel quickly, clearly, and accurately. But after age 60, your body becomes much less efficient at maintaining this protective layer. When the myelin sheath starts to break down, signals leak messages, misfire sensations, become distorted. That's when you feel tingling. That's when numbness sets in. That's when burning pain appears for no clear reason. Now, here's the crucial part. There is one specific B vitamin your body must have in order to maintain and repair this protective coating. Without it, nerve healing simply cannot happen. With it, nerve repair becomes possible even later in life. That vitamin is vitamin B1, also known as thiamine. In my clinical experience, B1 deficiency is one of the most overlooked causes of nerve damage in adults over 60. I've seen patients who couldn't hold a coffee cup regain steady hands. I've watched people who shuffled in fear regain confident steps. I've seen individuals who thought their active years were over return to gardening, cooking, traveling, and even dancing. Your nerves are not dead. They are injured and they are waiting for the right fuel to heal. Think of vitamin B1 as oil for your nervous system. Without oil, an engine grinds itself down. Metal scrapes metal. Damage accumulates. quietly until one day, the engine fails. That's exactly what happens to nerves without enough B1. Signals slow down. Messages become distorted. Your brain can no longer communicate clearly with your hands and feet, but when you restore adequate B1 levels, something remarkable happens. The body begins rebuilding insulation. Signals travel smoothly again. Sensation gradually returns. Now you might be thinking, I eat well. I take vitamins. Surely I get enough B1. Here's the uncomfortable truth. Up to 1/3 of adults over 60 are deficient in vitamin B. One in most have no idea. Why does this happen? There are 3 major reasons. First, reduced absorption with age. As we get older, stomach acid production declines. Less acid means poorer absorption of B vitamins from food. A healthy 30-year-old might absorb 60 to 70% of dietary B1. After 60, that number may drop to 20 to 30%. Same food, same diet, completely different absorption. Second, common medications deplete B1. Diabetes medications like metformin, water pills used for blood pressure, certain heartburn, and acid dressing drugs, all of these quietly drain B1 from your body over time. I've seen patients on these medications for a decade or longer never once warned about B1 depletion. Their nerve damage was blamed on aging when it was actually nutritional. Third, modern food processing strips B1 from foods, white bread, white rice, packaged foods. These are practically empty of thiamine. Even people who eat healthy may not be getting enough usable B1. Let me share a real patient story. Robert was 71 years old. He exercised daily. He avoided junk food. He did everything right. Yet his feet felt numb, as if he were walking on thick socks. He couldn't feel the pedals in his car. When I reviewed his medications, the answer became clear. Years of diabetes and blood pressure drugs had drained his B1 reserves. We started supplementation immediately. If this helped you, share it with someone you love. Subscribe for more senior-focused health education. Your best years do not have to be behind you. With the right knowledge and the right action, you can reclaim comfort, confidence, and independence. There's one more thing I want you to understand, and this is very important. Many people assume that once nerve damage starts, it's a one-way road downhill. They believe numbness, tingling, and burning are permanent scars of aging. That belief alone causes people to give up too early. But medically speaking, that belief is wrong. Nerves are slow healers, but they are healers. Unlike skin or muscle, nerves repair themselves gradually. That's why progress can feel subtle at first. One day, you suddenly realize, wait, my feet don't feel as numb as they did last month. Or I didn't drop my keys today. These moments matter. They are signs of recovery. What stops most seniors from healing is not a GITS, lack of consistency. I've seen patients start B1, feel slightly better after a week, then stop because life gets busy or they forget for a few days. Unfortunately, nerves don't heal on weekends. They need steady support every single day. Think of nerve repair like repairing a damaged road. You don't fix potholes overnight. You repair layer by layer. But if you stop halfway, the damage comes back. That SYI, always tell my patients, commit to at least 90 days before judging results. Another mistake I see often is relying only on painkillers. Painkillers numb the warning signal, but they do nothing to repair the nerve. In fact, they can delay real healing because they mask symptoms while damage continues underneath. Vitamin B1 works differently. It doesn't silence your nerves. It restores them. Now, let me talk briefly about balance, because this is something families worry about deeply. Loss of balance is not just a muscle issue. In many seniors, it's a nerve signaling problem. Your brain relies on feedback from your feet to know where your body is in space. When those signals weaken, balance suffers. That's why improving nerve health often improves balance even without physical therapy at first. I've had patients tell me, "Doctor, I don't feel like I'm walking on air anymore." That's nerve communication Returning another benefit people don't expect is improvement in mood. Low B1 levels are associated with irritability, low motivation, anxiety, and even mild depression. When nerve signaling improves, the brain often feels calmer and more focused. Many patients say, "I feel more like myself again." That matters, because health isn't just about walking, it's about enjoying life. Before I close, I want to speak directly to caregivers and family members watching this. If you have a parent or loved one over 60 who complains of numbness, burning feet, or balance problems, please don't dismiss it as normal aging. Ask questions. Encourage testing. Share this information. Early intervention makes a dramatic difference. And finally, let me say this clearly. You are not weak. You are not broken. And you are not out of options. Your body is asking for support, not surrender. Give it the nutrients it needs, stay consistent, and allow time for healing to do its work. If this message resonated with you, take one simple step today. Start supporting your nerves because your independence, safety, and comfort depend on them. And remember, aging changes the body, but it does not erase its ability to heal. 3 weeks later, he called me emotionally overwhelmed. "I can feel the ground again," he said. "I feel stable. I feel awake in my body." That moment changed how I talk about nerve damage forever. Now let's talk about what you should do, because details matter. Step 1. Choose the correct form of vitamin B1. Not all B1 supplements are equal. The form that works best for nerve repair is called benfotiamine is fat soluble, which allows it to stay in the body longer, penetrate nerve tissue more effectively, support myelin repair directly. Regular thiamine breaks down too quickly for many seniors. Always check the label carefully. Step 2. Take the correct dose for nerve repair. Mild symptoms, 150 milligrams daily. Moderate to severe symptoms, 300 milligrams daily. Vitamin B1 is water-soluble. Your body uses what it needs and excretes the rest. There has never been a documented case of B1 toxicity. Step 3. Timing matters. Take B1 in the morning with food. Include a small amount of fat eggs, nuts, avocado. Never take it on an empty stomach. Consistency is critical. Now, here's what most people experience. Week 1, improved energy and mental clarity. Week 2, subtle nerve sensations, returning weeks 3 to 4. Noticeable reduction in tingling and numbness. Months 2 to 3. Major functional improvement. Let me return to Margaret, the patient I mentioned earlier. She had fallen twice. She feared losing independence. She couldn't feel her grandchildren's hands. Within 6 weeks, she was buttoning her clothes again. Within 3 months, she returned to sewing. She didn't get her life back because of me. She got it back because her body finally had what it needed. Before you begin, 3 important warnings. Get blood work when possible B1, B6, and B12. If you have kidney disease or complex medical conditions, consult your doctor. Inform your doctor if you're on medications that affect B vitamins for best results. B1 works synergistically with vitamin B, 100 milligrams. Vitamin B12, 1000 mcg. A, high quality. B, complex. With your 4-week action plan. Week 1, start supplementation immediately. Week 2, add B. Week 4, review progress with your doctor. Avoid alcohol. Stay hydrated. Eat whole foods when possible. You do not have to accept nerve damage as your future. Your body is capable of healing even now.